On this edition of the Best Docs Network featuring Forest Park Medical Center, plastic surgeon Dr. Richard Ha, craniofacial surgeon Dr. David Genecov, bariatric and cosmetic surgeon Dr. Clayton Frenzel, ENT Dr. Andy Chung. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Centers. Of course, Forest Park Medical Center is one of the premier medical centers in all of Dallas-Fort Worth.
Yes, indeed, Candace. We're going to start the program with, a lot of great physicians operate here out of beautiful Forest Park Medical Center. And the first one we'd like to introduce you to is plastic surgeon Dr. Richard Ha.
The prevalence of skin cancer is only increasing, especially since we live in Texas, in a southern state. Just the amount of sunlight exposure is greater than, say, if you lived up north. And those who are susceptible can get skin cancers. The most common ones are generally less aggressive. They're called basal cell cancers. You have some more aggressive subtypes, such as squamous cell, and then the deadly killer, which is melanoma. Unfortunately, that's more rare.
Back in 2008, I had a little spot that was biopsied and came back positive as basal cell carcinoma. When I met Dr. Ha, he said that he would have to do a skin graft using a piece of tissue from my ear. That surgical procedure worked out really well. Scary at first, but it turned out really well. This year, in May, there was another spot on my nose.
In Dottie's case, she had a skin cancer on the tip of her nose, which is a very challenging location because there's not an easy way to just bring the edges of the defect together without creating a lot of distortion. So you're left with some of the other options. Well, skin graft on her was not a great option because of the depth of it. It was going to heal with a divot, something that had been very noticeable. So really we're left with the more complex option of doing a nasolabial flap, or borrowing tissue from the cheek, leaving it tethered to the cheek, and then attaching it to the nose. Dottie had that procedure done, and that trunk was left there for 4 weeks. She was a great patient. She hung in there. We went to that second stage. We divided it. I did some dermabrasion to kind of sand and smooth the edges of the scars, and she's only a few months out, and it's very hard to even tell that she had anything done.
Dr. Ha is just amazing. He's like an angel. He makes you feel comfortable. He held my hand and he said, "Don't worry, Dottie, you'll look great." And I just had to trust in him. When I think about everything that I've been through, I'm very happy, very happy. I still recognize my nose and I think it looks great. Healthy nose, yes. Cancer-free, yes. I'm very pleased.
Gastroesophageal reflux disease is actually commonly thought of as heartburn. The main malfunction is a malfunction of the valve at the lower esophagus, because food should be able to go into the stomach, but bile, acid, and food should not reflux back into the esophagus. And often patients have symptoms from this. One of the typical symptoms is burning pain in the chest that represents the acid refluxing back into the esophagus. Some people have difficulty swallowing where they feel like food is getting stuck in their chest. Some people can have abdominal pain, and a lot of times patients have trouble at night. They can't sleep flat in the bed because the acid goes up into their throat. Gastroesophageal reflux disease can be treated in a variety of ways. Usually mild GERD can be treated with lifestyle change, avoiding certain foods, propping yourself up on pillows at night in bed, losing weight. Then when patients really are not relieved of their symptoms with that, they can move on to medications. But about 40% of those patients who take medications are not well controlled with medications. And therefore, we have a new treatment called the LINX Reflux Management System that I'm performing here at Forest Park Medical Center that will treat this disease. And it actually will treat treat the disease at the source of the disease, which is the weakened lower esophageal sphincter. The LINX procedure is a new FDA-approved procedure, and I am partnering with Forest Park Medical Center to be the only center to perform this procedure in Dallas. It's a very simple and elegant treatment. And basically, the LINX procedure involves a band of titanium beads that have a magnetic core. And this is basically a necklace of magnets that are placed around the lower esophagus to help augment the weakened lower valve. And what happens with this necklace is that it actually will open when you eat, and it breaks those magnetic bonds, but then it closes and doesn't allow acid or fluid to reflux back into the esophagus. I'm really excited about the LINX procedure because I think it's a revolution in the treatment of GERD. I think patients who've been suffering from reflux symptoms and decreasing their quality of life, and it's affecting their normal activities, this is going to be a great solution for those patients.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Today we are at Cowboys Golf Club, where we are holding the Brian's House Charity Golf Tournament. We are title sponsors of this golf tournament and have been for the last 4 years.
Well, Brian's House was established 25 years ago as the place for children with HIV and AIDS and for their families. And we've served that role for 25 years and continue to serve that role today. We provide child care, we provide social services, we provide a range of support services for families facing that crisis. However, as the epidemic changed, we expanded our mission to take children with other special health needs. So now we take children with cerebral palsy, children with autism, children with breathing and asthmatic disorders, seizure disorders, just a wide range of other health problems.
The golf tournament does a number of things. Number one, it raises money for Brian's House. And so we get sponsors from the community, both the business community, the medical community, to help sponsor the golf tournament and help pay some of the care costs over at Brian's House. That's where the money goes, is to the care of kids. But more importantly, we have 90 some odd golfers today, and that's over twice as many as we had last year. And that in it of itself creates 90 more people who are prominent in what they do, leaders in the community in their respective businesses, and they begin to learn about Brian's House. And they can help spread the word to other people that Brian's House has a significant value for our community, and it's something that needs to be supported.
Forest Park wants to give back to the community. We're healthcare providers, so taking care of patients is what we do. It's what we do well. And although we're not all medically connected with this population of the children that are affected by HIV and AIDS, we also know that the community there's suffering that goes on, and that we should contribute in any way that we can.
We decided to have a lot of fun with it and put on some crazy loudmouth pants. So everybody's just having a good time. We have a lot of our staff out, a lot of our physicians out. It's just part of what Forest Park does, being involved in the community and being an active participant.
Forest Park Medical Center takes care of a lot of children. We take care of kids both at our Dallas location, our Frisco location, and soon to be the Southlake location. And taking care of children is important to us. We want to give back to the community and help Brian's House gain some of that notoriety with the people with whom we work.
Coming to see Dr. Wyatt, I was constantly clogged, my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle.
Jenna has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. one of the big problems she has is something I see very commonly, where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again, I can make trips with my husband, and I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery. Bill has a question for Dr. Glenn Eide. What is the hiatal hernia and how can I be treated?
A hiatal hernia means that some of the stomach has herniated through an opening in the diaphragm called the esophageal hiatus. The opening is normally small, 1 centimeter or 2 across, for the esophagus to go through. When it dilates, the stomach can move up into the chest, and when you breathe, the negative pressure of the chest opens the junction between the esophagus and the stomach, and that makes reflux that much worse because it allows acid to move past the valve, and it also pulls acid up into the esophagus. To fix a hiatal hernia, we would make little incisions, usually about 5 millimeters, which is about 1/2 inch, under the rib cage, usually 4 of them, to go in, free up the stomach, pull it back down into the abdomen where it's supposed to be, and put sutures to close that opening down to the right size.
The Best Docs Network, featuring Forest Park Medical Centers, is all about their amazing facilities and their amazing doctors, like Dr. Clayton Frenzel, who we're going to meet next.
After 5 years of general surgery, I did a fellowship to learn how to do bariatric surgery for 1 year. And then I did a second fellowship in cosmetic plastic surgery. And that allows me not only to take my patients through the weight loss surgery, help them lose the excess weight, but in addition to that, after they lose the weight, I can do the reconstructive surgery that addresses the excess skin that they're going to have or that they may have after they lose the weight.
When I started seeing Dr. Frenzel for my follow-ups, I'd lost about 100 pounds, and I ended up losing about 115.
And after her gastric sleeve, she had significant excess skin in multiple areas of the body.
After 115 pounds, you have a lot of skin that is sagging, and I needed a total reconstruction.
Not every bariatric patient that is going to need this type of surgery, but if you lose over 100 pounds, most patients will have some skin issues. The 4 areas that are the biggest concerns are the abdomen, back, the breasts, arms, and thighs.
When he saw that I was pretty much down to where I was going to be and wasn't going to lose anymore, then we started talking about the reconstruction. And I wanted it all done at once, and he says, no, it doesn't work that way. So we did it in stages.
My #1 goal is to get the patient to a healthy weight, okay? This is about getting the patient healthy. However, during that time and this massive weight loss, they can form this excess skin. At that point, the skin usually needs to be addressed.
And I said, I just want to look normal. I don't want to look fake. And he said, I can do that. I said, okay, I'm trust in you then, do it. And he just did a fabulous job. I look normal again.
And it's not until they take the skin off that they say, you know what, now I feel like my transformation is complete. Now when I look in the mirror, I see the person that I know that I am. Cindy did very well, had excellent results. She recovered nicely.
He gave me back me, because I've always been a very outgoing person. I love to be around people. We have a great life, you know, and I have my life back because I get to do anything I want to do.
Ann was suffering from severe sinus problems, and she credits Dr. Colin Perro for helping change her life. To find out more about Ann's story and other life-changing stories, log on to bestdocsnetwork.com.
As always, for more information on the amazing Forest Park Medical Center or any of the fine doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and be sure to click on the Forest Park Medical Center tab.
There you go. And right now, it is time to go to our next doctor who operates right here out of Forest Park Medical Center. It's Dr. David Genecov.
Biolife started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Genecov were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on, then everybody's a winner.
Today at Forest Park, we are testing our disaster plan. We're going to look at what kind of patients are going to be coming to the hospital and how we would handle those in a disaster situation. Every good company and every great hospital is going to have a plan of what they should do in case of an emergency, in case of a disaster. We have that in place. Now we need to know if it would work in the real situation.
Even though we're a small surgical facility, we are still an active part of our community around us. And in the event of something happening locally, we would like to be able to respond and participate. And there's always going to be people that will come in, and we want to be able to handle that. And you can never assess how you will handle an emergency situation until you actively try to go through it.
We had a lot of people today participating that were not part of Forest Park. We had our security program here, Fort Knox Protection. They swept through the hospital today to make sure that all the doors were locked and that the hospital is secure. We don't want anybody who might be exposed to chemical agents just walking into the hospital. We also had the participation of Brookhaven College nursing students. They played the role of our patients today. Sacred Cross EMS came and participated. They brought patients to our triage area so that we would know what it'd be like in case we did get ambulance to our hospital. Usually ambulances don't come to Forest Park, so that was something that we really needed to test today.
I think it went very well. I think it was a very good plan. People always, are confused when they're faced with a new situation, but we got it sorted out and we kind of got our flow going, and we've figured out our problem areas and what we need to correct and, tinker with so that we can work even more smoothly in the event of a real disaster.
Today at our drill, we had everybody here from lab to pharmacy, all the nursing staff, registration, just every department of the hospital that you can think of. Somebody was here representing that area and making sure that their clinical area was ready for a disaster. And I really appreciate everybody that came out to participate with us. You never know when a disaster might happen, and everybody has to be ready. So I just want to really thank everybody at Forest Park for coming out and participating in our drill and making it a success.
Now to our next doctor who operates right here out of Forest Park Medical Center. It's one of the top ear, nose, and throat doctors. It's Dr. Andy Chung.
Well, I woke up one day in early July, about 3 years ago, and had a small lump on my neck that I thought was an ingrown hair or something like that. But it continued to get bigger and bigger over the next several weeks. And that prompted me to see my regular doctor. So I ended up seeing an ENT, which he ran some tests. A week later, he diagnosed the cancer. I decided I need a second opinion, and I ended up in Dr. Andy Chung's office.
We sat down, I kind of discussed with him what I believe was going on. He had already had a needle biopsy of the neck mass, which confirmed that it was a metastatic malignancy called a squamous cell carcinoma. And he asked me what options he had aside from getting radiation and chemotherapy, which he was very concerned about.
Hearing the word cancer is something you only think happens on TV or to someone in the paper, but when it happens to you, it is pretty scary.
I talked to him about a minimally invasive surgical option where I described how we could go in and remove the cancer in the back of his tongue, literally with no incisions.
The tumor on my tongue was fairly large, and when I saw a picture of it, it looked like a great big mushroom cap way back in the back.
You can see this is the lymph node on the left neck that Mr. McNeff noticed. After surgery, we repeated this scan, and what you see now is that this bright orange mass that was in the back of his tongue is no longer there. So you can see that that tumor is completely gone based on the PET CT.
It seemed like I recovered pretty much from the surgery in a matter of days. The worst part of this whole procedure was the radiation treatment.
Our goal is to preserve speech, respiration, and swallowing. And I think because of that and that preservation, patients are recovering quicker, and the potential complications are significantly reduced.
I came to Dr. Meade because I was diagnosed with breast cancer. I had several options as far as procedures concerning reconstruction.
I think one of the biggest challenges that I face in breast reconstruction is educating patients. It's a time of crisis for them. It's very difficult for them to choose what they normally would choose. During the crisis, typically a patient will simply want their breast to be reconstructed as quickly, simply, as safely as possible, and just get me out of here.
DIEP flap was the way to go because the implants just weren't an option because there was always a possibility that they could get hard, and I liked the idea of it all being me.
You can take the skin and the fat from the tummy, you can take the blood vessels with it, and you can leave the muscle behind. So the recovery for those patients is much, much faster. Nancy had her DIEP flap and was up and around. Now part of this obviously is her spirit, but it's a lot easier to recover from an operation where your tummy muscle was just separated and not cut out. These patients where I leave all of the muscle, their recovery is so much faster, it's unbelievable. The typical patient is someone who has an adequate amount of tissue from their belly button down to about the level of where a C-section scar is. And if you tighten up your tummy muscles and you kind of pinch that area, that's the size of tissue that you can have for one breast. The DIEP flap is all natural, so it's a really nice reconstruction for a patient so that she no longer has to worry about the reconstruction. The recovery is about 3 weeks, and once they're done with that, they're done with their breast reconstruction for life.
I did go home with drain tubes and whatnot, but it took me about a month before I felt like I was back to fairly full capacity as far as moving around and going places.
It's a natural form of reconstruction. Once it's healed in, they're done. They don't have to worry about it any more than they worry about their tummy.
Everybody thinks I look amazing, and it's just been a very positive experience. I haven't looked this good in 20 years.
I was diagnosed with fibromyalgia 5 years ago, and I was experiencing chronic pain, exhaustion that wouldn't go away. I actually met Dr. Baek through his wife. Somehow the conversation that I had my fibromyalgia came up, and she said, my husband is doing a new study. It's called a PSTIM. And I was like, and she explained that it was for chronic pain, arthritis, fibromyalgia. It was FDA approved.
What is nice about PSTIM for patients is that there is very little prerequisites required to place this on. Outside of the contraindications of pregnancy or pacemaker, any candidate can benefit from PSTIM.
He installed it right there, and there was no drugs. I drove myself there, I drove myself home. Within 4 minutes of him putting it on, my headache started decreasing, and my pain started to ease up. And by that evening, I just felt great. And somebody said, you just look happy. And I was like, well, I'm not suffering from that chronic fatigue and that chronic pain.
There is a lot of skepticism initially with using PSTIM, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. So I took the initiative to talk to the distributor and made plans to be trained in the use, and that's how I became the first physician in Dallas to be licensed to use this device.
And my husband's gotten his wife back. My children have gotten their mom back. I don't complain. I'm happy. I feel great, and I'm really excited about it.
What I find rewarding about PSTIM is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. All right, Candace, that will do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Centers. Of course, some of the best medical centers in the entire Dallas-Fort Worth area.
You bet it is. With unsurpassed service, exemplary care, and the highest quality medical facility, prepare to have your expectations exceeded. And of course, for more information on any of the doctors or Forest Park Medical Center, visit our website, bestdocsnetwork.com. and click on the Forest Park Medical Center tab.
There you go. And if you have a question or comment for us, send us an email, info@bestdocsnetwork.com. So long, everyone. We will see you next week.